So welcome to the show, Dr. Greenberg. I'm so glad to have you, Julie. Thank you for coming on today.
Thanks for having me, Jen. I'm so glad to be here, and I'm a fan of your podcast.
Thank you so much. I know you're traveling, so I really do appreciate you finding the time to talk to the listeners about acne and what people can do about it. You know, maybe some things that have been myths in the past that we think may have been causing acne that you're finding the paradigm's changed a little bit. So I've heard you so many times speak at conferences on numerous podcasts, and I've been a fan for a really long time. So I'm so grateful to have you here. And before we jump into like what people want to know, what they can do about it, let's talk about what the causes of acne are that we know about.
Yeah, so it's interesting because, and I was telling you this before the podcast, I take my patients through a 30-minute PowerPoint presentation on acne as part of the first visit, because everyone wants to know, like, what is causing this? And acne causes not just physical blemishes, but a lot of emotional pain. People really feel insecure, and it's hard when it hits as a teenager, but it's still hard. It's hard when it hits as an adult. And there's so many things that we do know about acne, and then so many questions that we still have. So, I start with the pathophysiology of acne, and I tell patients that's really like, why is this happening? Like, physically, what's happening in your skin that's causing a pimple or a zit? And we have a really good handle on that. So I go through kind of four basic steps that happen to cause a pimple. The first is an overproduction of sebum. And if your listeners have never heard that word sebum, it's just kind of an oil, and it's produced within a hair follicle. And a lot of people are surprised to hear that acne only happens within a hair follicle. So that's really the kickoff point. That hair follicle has a gland called a sebaceous gland, and it just kind of goes crazy and starts cranking out way too much sebum or oil. The second step is too much skin starts getting produced. And then the third step is that hair follicle gets clogged and gunked up with like oil and skin. And the fourth step is you can get a little infection down there, and it can either be bacterial, which is classic acne that we think of. And it's a bacteria usually that we think of called C. acnes or Cutibacterium acnes. And it used to be called P. acnes or Propionibacterium acnes. So that's the same organism. So there's that bacterial side that can get down there. But there's another thing called fungal acne that can be caused by a yeast called Malassezia yeast, which is normally on the skin, but somehow it gets down into that hair follicle, starts getting gummed up with the sebum in the skin, and boom, you've got a pimple. So that's like physically what's happening in the skin. Then, of course, the question is, okay, why is this happening to me? And, how do I stop it? And that's a lot more complex. And that I break down into triggers and root causes for patients. So for me, a trigger is something that will certainly bring on acne or make it worse. But if we take that trigger away, does the acne disappear? And the answer is no. It's not like, oh, okay, if we just get rid of that trigger, poof, problem solved, your acne is gone. That's where we have to go to root causes. And root causes are really that thing that is driving the process. And if we can fix that, the acne will stop. And even if we fix that, a lot of the triggers won't trigger acne anymore, which is really fantastic.
Okay, that's so good. So I'm thinking in my head as you're talking, okay, so the root cause may be a number of things, which we're going to get into, but then the trigger may be like the masks we're wearing.
Exactly. Yeah. So there's a lot of triggers. I can kind of like name some off if you want. So and there are many triggers. So, and I'll say, acne is a pretty complex condition, which is why it's hard to treat. If it was simple, everyone would walk in, get a prescription, and boom, it would be done. But no, we have many different medications, oral and topical, and many different herbs and supplements to try to address it because it is multifactorial. It is complicated. Some of the triggers, and this isn't, not every trigger will cause acne for everyone, but kind of a list of triggers. It's things like, so our food, the Western diet, the four things that we love the most: meat, wheat, dairy, and sugar. Each one of them drives acne in a different way, and we can get into that for sure. Of course, hormones are involved. We know this. Insulin and testosterone, they hit that gland we talked about, the sebaceous gland, and it drives sebum production. So too much testosterone and too much insulin, we're going to drive acne. The things like the birth control pill, That can go either way for women. Sometimes it will clean up acne, and sometimes it will bring it on. And oral steroids can cause acne. Substances, a lot of times people are supplementing with B vitamins, and large dose vitamin B12 kind of changes the bacterial profile of the skin. We know it can drive acne.
I had no idea on that one.
Yeah, too much fluoride can drive acne. You mentioned mass, that's a good one, pressure. So we used to have something called chin strap acne that happened to wrestlers in high school, where we'd get this kind of pattern. And it was like, oh, that's exactly where the chin strap's going. Now we get maskne. And I have a lot of patients coming to me with maskne. It's a real thing. Due to that rubbing of the mask, you're breathing, there's a lot of moisture and a lot of trapped, bacteria or like malassezia. So those are just stress. Stress is a trigger. We know that that can absolutely cause flares of acne. So those are some examples of triggers that certainly can bring it on. But even if you remove stress, it's, sometimes people will still have acne, or you take away the birth control, you still have acne. So that's what I consider triggers.
Okay, so that's really good. If you go back to what we consider the etiology or the causes with the overproduction of oil or sebum, and then the trapped dead skin cells clogging the pores. And I was always taught that there's hormonal factors, obviously. And then once that clogged hair follicle, it ruptures under the skin and bacteria become opportunistic. And then if someone's been on a lot of antibiotics, or they're using a loofah or something like that, they can introduce other foreign bacteria or have the malassezia, which we've also called pityrosporum folliculitis, if anybody heard that word. So I'm assuming that, okay, I know about dairy and sugar. That's really well written about in our literature as far as being inflammatory and having high glycemic. But can we talk a little bit about meat and wheat, especially meat, and how is it more of a increases IGF sort of thing, or like what's the etiology with meat? Because I kind of like meat.
Yeah. Yeah. And I always caution my patients, tell them, like, I am not suggesting that you stop eating meat. I'm a carnivore. I believe, we have evolved to eat meat. The question is the portion of meat, the amount of meat that we're eating, and if it's crowding out the vegetables. So that's our main problem. A serving size portion of meat is like a palm size serving. So that's usually 3 to 4 ounces. You go into a restaurant and they'll sell, half a pound of steak. That's not an appropriate serving of meat. So that's what I mean by meat, not any consumption of meat. And I like to be clear with that. So let's talk about meat and wheat. How is this driving acne? And in order to do that, we have to get a teeny bit sciencey. And we're going to talk about something called the mTOR pathway. That stands for mammalian target of rapamycin. It's a mouthful. The simple way of thinking about mTOR is it's a growth pathway in the cell. And of course, the body's full of yin and yang, right? So we have these growth pathways. We need to build new things every second of every day. That's part of living. And mTOR helps with that. But we don't want mTOR to go crazy. And so we have something called FOXO1. And FOXO1 is going to help keep mTOR in check so it doesn't go bonkers. So mTOR is involved in that, etiology or pathophysiology of acne, because it's responsible for sebum production and skin cell production. And if you remember, we said those are the first 2 kickoff points in acne: too much sebum and too much skin cell. So mTOR has kind of gotten a little out of control, and it's just cranking out way too much sebum in the cell. And when we think about, okay, why would mTOR go crazy? Well, there's things that are going to activate it. And that brings us back to the meat and wheat. There's amino acids, and amino acids are just building blocks of protein. So every time you eat something with protein, it's filled with lots of different amino acids. Your digestive tract breaks down that protein into the amino acids, and then we digest the amino acids. There's one called leucine. Leucine is rich in meat protein and in wheat. And leucine is a signal for sebaceous glands, or those sebum producers, to start producing sebum. So it's actually the number one essential amino acid that we know will drive sebum production via this mTOR pathway. So again, if you're eating appropriate amounts of meat, 3 to 4 ounces per meal, it's not going to really cause you a problem. But we can definitely I think of some people who are eating much more than 3 to 4 ounces. And it's also crowding out the vegetables. And the vegetables are the things that naturally calm down that mTOR pathway. So that's where meat and wheat tend to really drive acne via the leucine and the sebum production.
I'm so fascinated by this topic because I follow both Dr. Gabrielle Lyon, and I don't know if you're familiar with her, but she basically stands for muscle-centric medicine, and she talks about how important it is to have meat and avoid sarcopenia, and all this stuff with mTOR is kind of nonsense. And then on the other hand, I listen to Dr. David Sinclair. I'm a huge fan of his and all of his longevity research. And I was actually listening to him this morning, and he talks about how exactly what you're saying with mTOR and how we need to, back off on how much meat we're having and increase our, intermittent or time restricted eater or intermittent fasting so that we can slow down this growth and reduce mTOR to increase longevity. And in, the animal studies, it's really proving to increase longevity. So it's just fascinating to me how there's two ends of the spectrum. Like I understand from, a risk assessment, how important it is to have muscle and why muscle is important in the body. So I'm kind of wondering in my mind, is there something we should be doing? And this is more theoretical than pointing to acne, but I'm thinking, is there something we need to be doing where we cycle, right? We hit mTOR hard and then we back off, but we hit it hard 4 to 5 hours a day. And then we don't hit it hard because we don't want to always be anabolic, yet we don't always want to be catabolic. But what you're saying is one more argument for, making sure that mTOR is intact and not out of control with our normal diets of eating 24/7 up until the minute we go to bed. And then as soon as we wake up in the morning. So what are some other things that can affect mTOR?
Yeah. So, and you did quote, correctly that we know that sugar and dairy are huge drivers of mTOR. With sugar, it's driving, it's filled with glucose. Anytime you eat sugar, it's going to hit your bloodstream and drive an increase in insulin. And as we mentioned, insulin is going to hit eventually insulin and testosterone kind of end up in a spiral where they increase each other, and then they're going to go drive sebum production as well. And it creates insulin-like growth factors. Well, what's the word we just heard? Growth, right? It's going to make things grow. So why not, grow your sebum and produce more oil? And dairy, there's a lot of things that dairy is actually very high in leucine as well. The casein and whey are proteins in dairy, and they're very, very leucine heavy. And wheat has, as we talked about, leucine as well. But the thing about dairy, I think that when we fundamentally just think about it as like, what makes sense, I ask my patients, what is dairy for? Why does dairy exist on the planet? And then I show them lots of pictures with babies feeding from their mama. And they're like, well, it's food for babies. And yes, that's the answer. It's exclusively food for baby mammals. In order to be classified as a mammal, the mama has to produce milk for an infant. And so when we think about the job of milk, it is filled with hormones, right? Its job is to make baby mammals grow quickly. And it's actually a life or death situation. If a tiny baby mammal, whether it's prey or predator, does not quickly grow into an adult, it's going to die out in nature. It's not going to make it. And that's why it's filled with hormones and growth factors. So when an animal drinks milk, it hits the body and it's actually ramping up mTOR as fast as it can. It's giving the message to mTOR like, hey, we're in a life or death situation. If you don't start growing something, we're going to die. So get out there and do your job, mTOR. Well, if we're already adults, we've grown, we've kind of done that. And, I think there's an aspect of mTOR looking around like, oh my God, we're in a life or death situation. What can I grow? Well, how about some sebum?
Right?
And, I always tell my patients, we're not talking about the deliciousness of dairy. It is delicious and a little addictive because it's meant, if you've ever fed a baby, the next thing you see it do is fall asleep, right? There's actually like endorphins that are released when we drink dairy, which is why it's a little addictive. But it's exclusively food for baby mammals, and it's exclusively food for mammals of that similar species. So we're the only species on the planet that drinks milk into adulthood, and the only species that drinks the milk of another species. And I just kind of leave that with people, and then they get to decide, what they're eating or not. But yeah, all of those things contribute for sure to mTOR and the hormones, as we talked about. Insulin and testosterone will drive sebum production and fire up that mTOR pathway. So
There's so many good points there. And I mean, it's hard because I always tell everyone if I had a last meal, it would involve cheese because you have the case of morphines and there's like an addictive opiate kind of feeling in there. And the more you have, the more you want. But if you can cut it out, it's just amazing how much like fluid retention I see in myself and in my patients, that when they reduce the dairy, they just are not as fluid rich and engorged and inflamed. So yeah, if you want to get really fat and have a lot of acne, then I guess dairy is the thing for you. But if you don't, then that's one more thing that Dr. Greenberg says, a good reason to avoid the dairy. Okay, so I just have a question about the testosterone, because I do see a lot of male patients that are on testosterone therapy and their acne is completely associated with testosterone and they're refusing to get off of it. So, I mean, how do we even consider addressing that? Or you just have to go back and adjust that testosterone or have their naturopath do that?
Yeah, so I will say that I don't treat hormones. Like I don't do hormone replacement therapy. So I don't give, a testosterone or estrogen or progesterone. I manage things through herbs. So I do, if a guy is on testosterone, obviously we want to check the blood and see what the levels are and make sure they're in range. Some guys want to, actually take too much testosterone for muscle building and stuff. And if that's their choice, I don't think there's anything we can do about it. Like we need appropriate levels of hormones in the system. And if you're taking testosterone and your levels are too high and you're getting acne, your body is telling you, hey, we've got too much testosterone in here. Most of the time, I'm sure we'll get into this, but I do gut microbiome testing on all of my patients, and all of my patients with acne, especially the females ones, they come to me and say, oh, I have hormonal acne, and they're convinced that they have too much testosterone. But the truth is I don't do hormone testing on my female acne patients standard anymore, unless they have a known condition like PCOS, where we know that there's insulin resistance and we would suspect maybe high estrogens or high testosterone, because the vast majority of my female patients, we would test them, their hormones. They do not have a hormone problem. They do not have high testosterone. Their estrogen and progesterone are fine. And so I think it's a little controversial, but for me, the vast majority of my acne patients, it's not a hormone problem in that, yes, they may see flares at certain times in their cycles. It's usually around ovulation or a little bit afterwards. There are varying levels of progesterone and testosterone during that time. And you can get flares, but once we clean up the gut, that doesn't happen. And I don't think that for the most part, acne is being driven by hormones, just because all the testing on my patients showed like they were fine. And when I clean up their gut, their acne cleans up. And so most of the time I'm not addressing hormones. And then we can talk about some very interesting studies that have been done on indigenous cultures and acne, which also shows that like it's not a problem with human hormones. It really is other things going on.
Yes, this is exactly what I want to talk about. So, even with PCOS, I just recalled, but I'm hearing you talk, I was diagnosed with PCOS when I was in my teens or medical school when I was young. And I found that when I changed lifestyle, everything kind of went away. All of those, PCOS diagnostic criteria went away, and I don't have any of those issues. So that, along with everything you say in the studies you're going to review, kind of point to the fact that, hey, let's not just go ahead and throw it away and say hormonal acne. Let's take a look at other things that, like, the listeners have complete power over, rather than just, succumbing to a diagnosis and throwing in the towel, that you can seriously change things, because we know that epigenetics is 80%, not, even if we're not dealt really great genes, we still have the power to bring out the best in them, So
Yes.
I just want to go back to the B12. So you mentioned that B12 can change, did you say the gut microbiome? So if you could talk about that and then talk more about the studies in the gut microbiome and how it all relates to acne, I'd love that.
Yeah, actually, the studies I've read on B12, like high, and I'm not talking about just a normal amount of B12 from the diet, but people on B12, either B12 shots or higher dose B12 oral supplementation. A lot of people are on like B complexes, maybe for methylation, but there's a lot of B12 in that stuff. The studies I've read talk about it changing bacteria actually on the skin microbiome. I'm not sure about the gut, if there's changes that are made there, but you know
Sorry.
we know with the skin microbiome, right, there's commensals on the skin or good guys like staph epidermidis and stuff. And we don't fully understand why that bacteria, Cutibacterium acnes, which again is present on skin, but it can be there and you don't have acne. Malcesia is on everybody. Doesn't mean you have fungal acne or Pitiosporum folliculitis. And so we don't fully understand that skin microbiome piece with acne. Is it just that it's diving and getting into the hair follicle? Is it changing? And there's something about high dose B12 supplementation that seems to change the metabolism of bacteria on the skin. And that's what I read about is kind of driving like a C. acnes type
That's interesting.
increased response.
There must be a Goldilocks phenomenon, right? Because you were at, you spoke at the Integrative Dermatology Symposium, and I heard Dr. Peter Liao, he's been on the podcast in the past. We've talked about a lot of atopic dermatitis and eczema, which is sort of his area of expertise. And he discussed, which I haven't shared with the audience yet, but he discussed using B12 in a moisturizing lotion to help with eczema. So there must be some sort of a perfect balance where B12 can be helpful and then it can be harmful. So it just goes back to everything that we discuss all the time. There's something may be helpful at a certain dose or a certain amount, if you're dealing with something, but then it can cause something else if, clearly you don't, it's too much. So that's fascinating. So B12 does play a role, but what I hear you saying is, don't avoid it. Just, be aware that if you're dealing with acne, maybe you may be supplementing too much.
Yeah, I check when my patients come to me and they have acne and we go over their supplements. If they're on a B complex or B12, I look up like how much is in there, because some of them are just like a little bit of B12, which is still like multiple times over the recommended daily allowance. And some of them are like 10,000 times, right, the recommended daily allowance. So we do want to see the actual quantity in the supplement, and you can just experiment. Just take it out. Do things get better? Doesn't matter. Okay, you can put it back in. It's real easy to test that. So
because it's a trigger and not a root cause. So yeah. Let's talk a little bit about these root causes that you're aware of and how you work with your patients.
Yeah. So as a naturopathic doctor, we have certain kind of mandates. One is find and treat the root cause. And the second is treat the whole person. So I'm a naturopathic doctor and I say I specialize in dermatology, but I really also specialize in the gut and kind of the whole person, because I think, a lot of times in Western medicine, it's in some ways brilliant. We have these specialists who all they do is focus on, one organ system and they know so much about it, but then we lose the ability to kind of connect that with the other body pieces. And I mean, our skin is an organ that gets the biggest blood supply in the whole body. It's connected. We don't take off our skin and hang it in the closet at night. And too often, I think we think about the skin as something separate. So I'm always connecting things. And I started to run gut microbiome tests on all of my chronic derm. I only treat chronic derm, so all of my patients. And I started to see just really fascinating things coming through. And so when I say gut microbiome, I'll take a step back for your listeners. What I mean by that is the average adult human has 3 to 5 pounds of microbes living in their gut. That's astounding, right? Just trillions and trillions of bacteria and fungal elements like candida and even malassezia or other molds. It can be organisms like protozoa, lots of things living in the gut. And if we stop and think about why do we do that? Why are we carting around 5 pounds of foreigners? We're giving them a free home. We're giving them free food. Like, that's weird. What are we getting out of this deal? And the answer is a lot. We've co-evolved with these microbes. We need them and they need us. And they make things for us that we can't make for ourselves. And they help keep us healthy and they help keep out bad guys. So there really is a handshake deal we've made with these 3 to 5 pounds that we're carting around and feeding. When I talk about gut microbiome dysbiosis, that means that it's gotten off. There's it's usually both a combination of too little good guys and too many bad guys. So that's when I say I do gut microbiome testing, I'm looking to actually see what species are living in your gut, what species of bacteria, what species of fungal elements. And I do that with a stool test and a urine test called an organic acid test. And I kind of use both of those labs to paint a picture of a patient's microbiome and what's going on in there. So I run, hundreds and hundreds of these on patients, and I started to see patterns happening by skin disease. So my acne patients have a certain set of problems that are going on. It is very, very different than the problems that are going on, let's say, in my eczema patients or my psoriasis patients. So I can almost tell now just by looking at the labs what skin condition somebody is dealing with. And I actually published research on the gut microbiome of my acne patients in 2021 and presented it at a couple different medical conferences. And what I find in my acne patients is really three specific things going on. And that's not to say that there's other problems too. Everyone, we say, treat the person in front of you. So I run labs on everybody because there's things I now expect to see, but everybody's different. And I got to know what's going on with you, patient in front of me. But what I expect to see in my acne patients is a high level of candida overgrowth in the gut. And candida is another yeast. Yeast is a single-celled fungal organism. I see high levels of H. pylori or Helicobacter pylori. That is a bacteria that grows in the stomach. And in about half of patients, I see protozoal overgrowth. And there's lots of different types of protozoa. There's Blastocystis hominis, there's Endolimax nana, and there's more pathogenic ones like Giardia. But those are the three things that I tend to see over and over again in my acne patients. And when I fix the gut, the skin clears. It's just miraculous.
Okay, so this is great. I'm so excited about the fact that we're just changing the way we see things, for so long, and it makes complete sense. But I think a lot of people are going to wonder how does what's happening in the gut microbiome actually affect the skin? Because we know the skin has its own microbiome too. So why is it affecting the skin?
Yeah, so it's a really good question. We don't have all the answers yet. So I have done so much work trying to find published research. My job, I kind of feel like, a super sleuther, right? I'm almost like an investigative reporter trying to connect pieces and how does the story make sense? Who done it? Who's doing the acne? And I did find a connection with H. pylori. So it's very interesting with Helicobacter pylori or H. pylori. As I said, it grows in the stomach. And there's a research study that shows that, well, actually, so I should take a step back before I talk about this. So we talked about mTOR and how mTOR kind of goes crazy and starts producing too much sebum and skin cells. And that's kind of the kickoff point in acne. But the body has mechanisms to normally keep mTOR in check. And so there's something called FOXO1. And I tell my acne patients, in the story of acne, mTOR is a little bit the bad guy and FOXO1 is your friend. Because it's not that mTOR is bad, but mTOR's gotten out of control, right? It's like a teenager that's been left home and is without parents and is throwing a party and it needs a little bit of, discipline. Well, FOXO1, what?
An unlimited budget in food, right?
Exactly, yes. So FOXO1's job is to come in and really regulate mTOR and say, you know what, mTOR, getting a little bit out of control, producing a little bit too much sebum. Let's slow our roll here. So, but we need appropriate amounts of FOXO1, and it's a little complicated, but it needs to be in the nucleus of the cell. We won't get that detailed. So we need FOXO1 to control mTOR. So let's go back to this H. pylori in the stomach. How is that impacting anything happening on the skin? They've done studies in gastric cells. So these are the cells of the stomach. And what they found is that H. pylori kind of inactivates FOXO1 in the gastric cells in the stomach. So I have not found any research that has connected H. pylori with FOXO1 in sebocytes, but I don't think it's a crazy stretch to think that perhaps it is actually doing that. And because everything gets into the bloodstream, if you have leaky gut, there's a lot of bacteria and stuff getting into your bloodstream. But even if you don't, the whole point of eating is we need to break down food. Like, let's take that protein we talked about, we're breaking it down into amino acids like leucine. All of those nutrients get through the gut and into the blood. And then the blood takes it out to every cell in your body, from the hairs on your head to the toenails on your pinky toes. Every cell needs those nutrients that have come through the gut in order to live and survive. So I don't think it's unreasonable that, some H. pylori is getting out, and not like in a septic kind of infectious way, but there's just stuff in the bloodstream. There just is. And I think it's entirely possible that it is affecting the sebocytes, the cells in the sebaceous glands and hair follicles, in that similar way. It's inactivating FOXO1. And there is another research article that was published basically with a hypothesis that acne is due to a lack of FOXO1 in the sebocytes, in the sebaceous glands, in the hair follicles, and that without that enough FOXO1, mTOR goes crazy and produces sebum. So those are, they're kind of loose pieces. I kind of look at it like I'm assembling a puzzle, and it looks like these pieces might fit. So I'm putting them kind of over in the same corner, and hopefully they're going to click in and I'm going to find that piece later. But I do think that's one explanation for H. pylori. The protozoa, I'm not sure if the protozoa themselves are driving acne, or if it's like, because I do think they're inflammatory to the system, or if they just kind of come along on the coattails of the H. pylori, because H. pylori is a bacteria, as I said, it lives in the stomach. And that actually does have a lot of repercussions for the whole GI tract, because our stomach is supposed to be filled with very punchy, robust stomach acid. And I think of stomach acid as having two main jobs. One is it needs to start to digest and break down that food, like a chicken breast. How do you break down a chicken breast? That's hard to break down animal protein. Well, let's throw it in a vat of acid. It's a pretty effective way to break food down. So that's its starting point in our gut. Throw it in a vat of acid, let's disintegrate it, and then we can extract those nutrients much easier. And the second thing our stomach acid is, it's a killer. We swallow 1 liter to 1.5 liters of saliva a day. It's filled with bacteria and organisms. And we don't think about it, but every time we take a bite of food or drink a sip of a beverage, we are also bringing a lot of organisms, bacteria, virus, mold, all sorts of things right down into our gut. Well, instead of having to fire up the immune system and have it fight and kill everything that we swallow, nature got smart and is like, hey, let's just have it drop into a vat of acid and sizzle and die, most of those things. So that's really the design. But when H. pylori sets up shop in the stomach, it gets in there and it's like, you know what, this is pretty acidic. I'm not loving this environment at all. Let's redesign. Let's make some changes. And it tells the stomach, please stop producing so much stomach acid because it's super uncomfortable. And let's change that pH. Let's make it less acidic and more neutral. So that's a more comfortable environment for H. pylori. But now the stomach acid isn't doing its job. It's not as good a killer, and it's not as good a digester. And so when we take in protozoa through food or drink, not all of them end up dying in the stomach. And if they get out into the small intestine or the colon, they can set up shop and start having a little protozoa party. So again, I don't know if the protozoa is really just kind of there as a function of the H. pylori, because I really, 95% of my patients who had protozoa, they have H. pylori. You almost don't get protozoal overgrowth without the H. pylori changing that stomach acid. Stomach acid will usually kill them.
Yeah. So are they opportunistic because the H. pylori has made the environment change, or are they part of the process? And going back to what you said about the FOXO1, it makes complete sense, because if you think about all of the processes in our body, it's all through communication, and our organs are all interrelated. That's why I love treating the skin, because the skin is a representation of what's going on below. So if there's high FOXO1 or low FOXO1, it's going to be showing itself in the skin and probably other organs in ways that we don't necessarily even understand. And when I hear you talking about this in the sebocytes, which are the oil glands, basically the oil producing cells in the glands, how do you know what role vitamin A, isotretinoin, the old name of Accutane, how does that work in reducing sebocytes? Is it through FOXO1, or is it another mechanism of action? I don't even know. And I've been using it for 20 years.
Yeah, so it's a great question. I mean, my understanding is that isotretinoin, or what we used to call Accutane, actually kills sebocytes, kills that gland and shuts it down. So, but that's, a retinol derivative. So I don't prescribe isotretinoin, so I don't know that specifically about that. But there is a lot of research that looks at medicines that we use for acne and the impact of FOXO1. So what I've been able to find is that both with isotretinoin, so again, what we used to call Accutane, and the tetracycline, so doxycycline, minocycline, it's a class of antibiotics that we prescribe a lot for acne. It's kind of a lower dose, longer term. Studies show that it does tend to increase FOXO1. And for topicals, benzoyl peroxide and azelaic acid, there's evidence that so those are topicals that we use on the skin, that those also increase FOXO1. So we are understanding that some of the mechanism of actions of the drugs, the pharmaceuticals that we're using to treat acne, some of the mechanism of action is increasing FOXO1.
Okay, that's really interesting because Malassezia produces azelaic acid, which makes the skin white, right? So it's
Yes.
perfect harmony that I have so much more respect for the human body the more I study it. Okay, so thank you for going down that road. So as far as working up, like how should people try to get evaluated properly? Let's assume they have telemedicine access only. Like, is there anywhere they can start with that if they can't do studies, or how do they find a practitioner that will work them up properly? Like, what's your normal, list of things that you do? How do you?
Yeah, because of COVID, I have been exclusively telemedicine for the past 2 years. So I have only seen patients virtually. Patients are required to send me photos before every visit. We look at them together on screen and we compare photos from visit to visit. So for the kind of chronic conditions that I treat, I don't need to actually see them in person in office. When they ask about things like, oh, I've got a funky mole, I'm like, you absolutely need to go see a board certified dermatologist in office. They're going to use a handheld microscope called a dermatoscope that you need to be seen in person. So I think it depends on the problems that people have, whether they need to be in office or whether you could do telemedicine. For me, all of those chronic derm diseases I mentioned, things like, acne, rosacea, eczema, psoriasis. I treat a lot of alopecia areata. I don't really need to see them in office. If I need a biopsy or a culture, I'll send them to see somebody in office. But I don't think it's actually necessary. The testing that I do, the stool test and the urine test, those are kits that are sent to patients and they do them at home. So even when I was seeing patients in office, no one can poop on demand. So you're not going to be doing the stool test in my office. And the urine test is a first morning urine test. So it's really convenient that kits get shipped to patients at their homes. They do them at their leisure. And then they package up the kits when they're done and they call FedEx and they come pick it up from home. So I don't think having to see a doctor via telemedicine is any issue with these chronic derm conditions.
What stool test company do you like to use?
So I prefer the GI map by Diagnostic Solutions. For me, it gives kind of the best set of results, and I think it's the best price point. And it includes H. pylori as a standard feature in the stool test. It's not an extra add-on. And I need to see if there's H. pylori there. There's debate in the naturopathic and functional medicine community, like, is H. pylori really bad? Are some of the non-pathogenic protozoa really bad? But for me, yes, the answer is yes, and I'm always going to treat H. pylori and any protozoa that show up. So yeah, the GI map is the one I use, and then I use an oat organic acid test by Great Plains Labs.
Okay. Yeah. I mean, if you think about it, like if you want to go to Boston or if you want to go to London, you don't know where to go until you know where you're at right now. Right. So, I mean, I know the tips you've given are going to help everyone with their overall health. I mean, just, reducing meat, and I'm sure that grass-fed, pasture-raised is always going to be better than conventional, reducing or eliminating wheat and dairy and sugar, to the best of your abilities in our society, especially right after the holidays. We don't want to cause too many guilt trips here. But I mean, those are going to benefit everyone, and they're not going to harm. But then when it comes to actually getting down to the meat and all the details, you really have to get this workup so you know where you're at. Otherwise, you don't know where to go from here.
Yeah.
How does it work as a naturopath? Do you have to see people in the states that you're licensed in? Because I know with telemedicine, I'm licensed in 22 states, but if there's a 23rd state, I can't see those people. Is it the same for you?
Yeah, so naturopathic doctors are regulated and licensed by state. It is a very, very wide range. So I'm licensed in California, Oregon, and Washington. So I can be anywhere. My patients have to physically be located in California, Oregon, or Washington, even if it's a telemedicine visit. And like in Oregon and Washington, I'm primary care physician level. There are other states where we're unlicensed, and in Tennessee, it's illegal to practice naturopathic medicine. So I could go to jail for practicing there. So you can see it ranges from primary care physician to illegal. So we really do need to pay attention to our states. So I will only see patients who reside in California, Oregon, and Washington. And yeah, it's just depends on the state, whether there's licensure or not.
Okay. So I have a few other things. I want to talk about like why people have an overgrowth of H. pylori, but I just recalled something I heard during the Integrative Derm conference where Lactobacillus rhamnosus SP1 strain was beneficial for people with acne, or would you say that's not really a broad statement that you feel comfortable making until you know what their microbiome is to begin with?
Yeah, I know, I understand the drive to find like, what's the one strain and species, that's going to fix the acne or the eczema. And, in eczema, it's Lactobacillus rhamnosus GG. And it's like, everyone's like, we need the GG. It's too simple. It's just too much of a simplification for me as a naturopath. So it's great if you can find a strain. I tend to use a lot of spore-based probiotics because they kind of do a more complex job, in my view, of going in and kind of helping the good ones thrive a little bit more and pushing out the bad ones. And, I like the idea that if they live in the soil, maybe that's how we really did used to get probiotics as cavemen and cavewomen. We certainly were not going to Whole Foods and getting refrigerated, Lactobacillus and Bifidobacterium strains. That wasn't happening. So, is that what was happening? I don't know, but I feel like it's a reasonable hypothesis, and I do like the spore base. So I don't really worry about trying to find a specific strain of a bacteria that's shown up in research to help this disease or that disease. And it was a little frustrating, I'll say. At first, I kind of was trying to do that path, but a lot of the ones that they use in research aren't commercially available. So you're like pulling your hair out because you're like, well, if this is the thing, why isn't it available? So I just don't practice that way.
Like, how do you give advice when something's not even accessible for people?
Yeah.
So H. pylori, why does it overgrow in the first place?
Yeah. So I will say, again, there's a huge debate in the naturopathic community and functional medicine community about the role of H. pylori. And some studies show, no, it's good and it's not a problem and leave it alone. And, everybody's kind of got their own opinion on it. Anywhere from 25 to 50% of people will show up with some H. pylori. So it's not like a rare thing to have, and it's easily transmissible. So certainly we already know that sexual partners share a lot of their microbiome because you're exchanging microbiomes on many levels, right? Oral through saliva, genital, skin to skin contact, but even family members with it, it's just, in a non-sexual capacity, they share microbiomes as well. And it can happen through mom tasting food. So H. pylori is easily transmissible amongst families, as well as romantic partners. And
with Dr. Sarah Silic, and this was probably a year ago now, and it was exactly about what you're saying. And we talked about be discerning with who you kiss, because you'll be sharing your microbiome with them and theirs with you.
Yeah, you really, really do. But it's more than that. You take a sip of somebody's thing, or you take a bite off their fork. We're swapping microbiomes. So you can get H. pylori that way. And candida as well. So sometimes with patients,
Right.
I need to look into if stuff is like recurrent. Like I can usually clean up the H. pylori, and I don't use pharmaceuticals. So there's triple antibiotic and quadruple therapy for H. pylori as a pharmaceutical option. I use herbs and supplements, and I clean it up all the time. But if there's reinfections, then we have to start looking at other family members, in particular romantic partners, and see if they're swapping it back and forth. And that happens with candida. My female patients with recurrent vaginal yeast infections, whether they have female or male partners, they can be passing it back and forth. So sometimes when you clear it and then it keeps popping up, you got to look to the other people in the household or relationships.
Right. And we see that with staph infections too,
For sure. Yeah.
Where some people are carriers and they don't get it all over their skin, and other people keep getting it. Okay. So can you talk about some of the treatments and things that you like to do?
Yeah. So again, I know people want what's the treatment plan for acne? And I don't have one because, a basic tenet of naturopathic medicine is, treat the individual. So I don't have an acne plan per se, but of course there are things that tend to come up a lot in acne patients. And I will say that all of my treatment plans are dual pronged. So there are topicals that I use for each condition. They vary widely, whether you have acne or eczema or psoriasis. And then all the gut protocols, also vary by condition and what I'm seeing on the labs. For H. pylori, there's a lot of really great supplements out there. And I don't think you need to use pharmaceuticals, because in my experience, it's just, you can clean it up. We use things in the naturopathic world like mastic gum. We use zinc, we use bismuth. So lots of some DGL, deglycerated. It's like a licorice that's removed the glycerides. Those are the kind of supplements that I tend to use for H. pylori. I actually like Filipendula ulmaria, which is meadowsweet tincture. I find that works well as well. There's studies on black cumin seed. You can grind it up in honey. So for kids, it's a little more challenging. Sometimes my eczema patients will pop up with some H. pylori. It's not as common. It's much more rare, but it's harder to treat kids because they can't swallow the capsules, and not all that stuff is tasty. But lots and lots of H. pylori protocols, and my protocols change every 2 to 2.5 months. So I meet up with patients virtually for appointments every 2 to 2.5 months, and protocols change. I like to switch out all the herbs every 2 to 2.5 months, because even though I'm using herbal blends and we don't get antibiotic resistance in the same way that we do with pharmaceuticals, there's still, herbs do a better job on certain bacteria and fungal elements than others. So I want to change them every 2 to 2.5 months so that we're moving through different protocols and treating different things. I use, a lot of, it's all herbs. So I don't prescribe pharmaceuticals, and, it's everything from berberines to, there's herbs that we like when there's candida, there's blends that are more specific to fungal organisms, like a pau d'arco. What else is in there? Black walnut hull. I'm an herbalist by naturopathic training, but I'm also a registered herbalist. So we kind of know, in the same way that there's pharmaceuticals that, you would use on certain bacteria or certain fungal elements, we do the same with herbs. And then for the topicals, I'm trying to use things that are good for the skin, that are going to restore a healthy, acidic, natural pH to the skin, but reduce sebum production. And there are lots of beautiful oils and essential oils that can help with that process. So it's interesting, patients do their own thing. So I have certain patients who are like, I don't want to use your topicals. I only want to use the oral supplements. We can clean them up. Other patients who are like, oh, for whatever reason, I just didn't do any of the oral plan, but I did the topical. They got great results. So I like to combine them. Let's do all the things that we can. But it's interesting sometimes to see, just the topical or just the oral being able to work on its own.
Right. Okay. I love what you're doing. I feel like you're such a gift to the dermatology world, because you're allowing those of us that are interested as a dermatologist, in the integrative dermatology sector, which is growing. It continues to grow every year. I love getting together with different specialists and seeing things in a different perspective and a different light. And this, as long as I've been treating acne, this is going to change what I do for sure. And I'm thinking in my head as you're talking, we know hormones change the microbiome, right? Where I'm throwing a lot of spironolactone at people. So what are your thoughts on spironolactone? Is it just a Band-Aid like a lot of the other things we're doing? And how does it even work if the gut microbiome is the cause or the root cause in the beginning?
Yeah, so I have a lot of patients who are on spironolactone who want to get off it, and that's why they're coming to see me. And I have a lot of patients who were on spironolactone, a lot of whom it worked, but the side effects were just too great, or they just didn't want to be kind of forever on a pharmaceutical, so they took themselves on it and the acne came off. I will say, spironolactone is effective for a lot of women, and if it's working for women and they like it, then you don't need to see me. But people tend to come to naturopaths when they want to get off the pharmaceuticals, and pretty much I think all of my patients use the word, I want to treat the root cause when they come and see me. So yeah, for me, spironolactone it's a Band-Aid because it doesn't fix anything. It's an androgen receptor blocker. So it is going after that kind of hormones, and we can get at acne that way sometimes. Sometimes spironolactone doesn't work. It's not a silver bullet for all people. But I've always been able to get patients off of spironolactone. And by that, I don't take them off it. I always say, never, ever go off of your prescribed medication on your own. Always work with your prescribing provider. So I like to make that clear to your listeners. do not go off of prescribed pharmaceuticals on your own. You need to work with a practitioner to come off it. So that's kind of how I work with getting my patients off it. But I say, like, look, if they're really freaked out about the acne coming back, so I'm like, let's and so a lot of times they're on spironolactone and it's helping, but it's not fully gone. So my method with those is, why don't we wait? Let me clear your acne, and then you can start to come off the spironolactone, and we'll see where you're at. And if it's still flaring, that just means we have more work to do. But I've always been able to get them off it.
Yeah, I agree. I'm not comfortable with keeping people on medications for long periods of time. And my brain is churning. The cogs are just churning right now because I've had success getting people off of it in 4 to 6 months with this lifestyle plan that I put together for them. And now I'm reviewing my lifestyle plan, which I thought was more anti-inflammatory, getting rid of the xenoestrogens in the environment, that sort of thing. But really, I'm now recognizing, I'm having this aha moment, recognizing that, oh, it's because I'm helping them with their microbiome, not to the degree that you're able to, because I'm not doing the testing that you do. I don't have access to it yet. And yeah, I'm having a lot of ahas now, and it's going to change what I do.
Yeah, I mean, what you're saying, it's very powerful. I say to all my patients, I will say, my plans are robust. There's a lot of oral supplements. There's a lot of stuff that we need to do to fix and correct the microbiome. But I always tell my patients, my goal is to not have you on them. If I'm just keeping you on supplements forever, then I'm also just a Band-Aid solution, right? I want to get in, fix the gut, and get out. But from the first visit, what we're working on is 35 grams of fiber a day, 30 different vegetables a week, because I can see what's wrong with the microbiome and I can fix it using herbs and supplements. But it's not going to stay healthy unless we get you eating 35 grams of fiber a day as your new lifestyle, because the good microbes in the gut, they are waiting for fiber. And if it's just like any animal, any organism, if you don't feed it, it starves and dies. So we have to feed the good organisms, and that really requires a lot of fiber. So the first visit, they have homework. You have to track your diet for 3 to 4 days and send me the fiber totals. And I always say there's no judgment. You are going to be low. 95% of Americans are not getting enough fiber. We just aren't taught about it. We don't talk about it. We don't think about it. So don't worry about what those numbers are. Let's just get an accurate, starting point. And then we slowly over time start to work up to 35 grams a day. That way I can clean up their skin and get them off of the supplements and send them on their way. But if you aren't eating a good amount of fiber, you can't maintain a healthy gut microbiome.
Okay, I know we're so over, but this is amazing. So besides increasing fiber to 25 grams a day,
35.
I have some work cut out for me. Besides increasing fiber to 35 grams a day, I'm sure you're not talking about Metamucil.
Nope.
But through real food diet that's going to feed your real bacteria.
Right.
Other tips that people can take away from this podcast on how to improve their microbiome?
So yeah, aside from 35 grams of fiber a day, which we're working up to, let's see, for people to do, I mean, all those, for naturopathic medicine, we really do focus on lifestyle issues. So I'm actually a big fan of getting a good, like 5 to 20 minutes of sun exposure a day, through getting natural vitamin D, making sure we're exercising, making sure we're getting enough sleep, and finding stress reducers. I can't give medical advice to people who aren't my patients. I know they want to know like what herbs and what topicals, but I do think, there is this idea of, so healthy skin is skin that's acidic. It's a pH of like 4.5 to 5. I just turned 50 yesterday, so I practice what I preach, and I use like aloe vera gel and hydrosols and plant-based products on my skin every day. Just really healthy, natural things. I think that's always going to serve your skin, both for acne and for anti-aging. Yeah, just really, find a practitioner who can help you through this. I have patients who are vegans and vegetarians who are so frustrated because they are eating 35 grams of fiber a day. They are doing the right things. But 100% of the time when we go test their gut microbiome, there's the story. It needs to be cleaned up with either herbs or pharmaceuticals. However, somebody is going to help you, but it needs to be cleaned up. And then, you can go on your way. But don't struggle alone. Find somebody who knows how to help you through this process, I would say.
Thank you for that. And what I love, as I'm listening to you, what I love to hear so much again and again is that all of the answers are really just going back to nature, because nature has all the answers for us to help our body optimize themselves. Okay, so before we finish up, Julie, I ask everyone a question, which I'm going to ask you is, how do you define radiance?
I think radiance, like when you look at somebody and you're like, they're radiant, it's like actually joy bursting through from like the inside out. It's like, sunbeams and sunlight. And, I think we get joy from our loved ones, from doing things that we're passionate about. Yeah. So for me, that's radiance. It's just joy bursting through.
Thank you so much. I really, really appreciate your time. Thanks, Dr. Greenberg.
Thanks for having me.